once again, thank you everyone for joining us on this virtual panel with these very wonderful people from all across BC. To start off with, I'd like to say thank you to all of them once again, and I'd like to give them a minute to each to introduce themselves.
Okay, I guess I'll start since my name is on the left. Hi everyone, my name is Alex. I'm a fourth-year mechanical engineering student at UBC. Back in March, I co-founded COSMIC along with Philip here and Dr. Christopher Guan. And yeah, happy to be here and yeah.
Philip, you're next.
Yes, that's me. So I'm newly minted Dr. Philip Edgcumbe, having just completed the MDPhD program. My background is in engineering physics in my undergrad and a PhD in biomedical engineering, and I've always been passionate about looking for opportunities to bring the world of engineering and technology to the front lines of medicine. And I've done that through my research and through a variety of startups. And when the disruption of COVID came and the new needs started to arise, it felt really natural and just the right thing to do to work with Alex and Dr. Guan to create the collective open source medical innovations for COVID-19 COSMIC group and start innovating and helping frontline healthcare workers with solutions.
Hi everyone, my name is Callie Readwin. I'm one of the co-founders of Vancouver Makers for Emergency Response and Support, or as we call it, YVRMERS. I am a business analyst and my background is in communications and marketing, but my partner, Sean Wormsbecker, is an emergency physician, and we co-founded this organization together in order to bring all of the makers together and focus our efforts as opposed to all working in silos. So it's our intention to reduce the stress on the supply chain and also give a spot for all the makers to come together and work together on the same issue.
Awesome, thank you. And so our main topic today is for understanding how people are able to lead in times like these, and what did it take to build the awesome teams you're now all part of. And so it looks like Philip has already kind of talked a bit more about the background to how COSMIC came to be. So Kaylee, could you tell us a bit more about YVRMakers?
Yeah, so I'd be happy to. So it was really Sean's brainchild. He with a friend of ours, Nick, decided, hey, we have a PPE shortage in the hospitals, and we have a whole lot of people who are good at making things, and Sean's also a hobbyist maker. So he thought, well, this makes sense, let's put them together. Let's start making face shields and PPE and fill the gap where there wasn't access to stuff. And we kind of knew that this was all coming because of Sean's connection in the medical community. So we really understood the scope of what was about to happen a little earlier than most. And so so he pitched this idea to our friend Nick, who's a maker and tech guy, and he did all the legwork of building the organization with the oversight of Sean and my support from my background in business and social enterprise to sort of solidify all of the structure. But the start of it was really Sean's idea of, hey, how do we meet our needs in the hospitals, and how do we actually make PPE or bring together resources that hospitals will find acceptable? Because there, of course, it's regulated, and there are limitations to what makers can offer a medical environment. So so yeah, I think that about sums it up. We've been working at different times in different capacities, but it's kind of the buck has been passed to me, I think, now for building the organization larger, and Nick did a lot of the legwork for getting all of this started. He started the Slack channel, I started the social media, started recruiting volunteers, and now we have several team leads and weekly ops meetings, and moving towards a social enterprise model for all from a few hundred volunteers now up to, you know, thousands of volunteers under our belt. So it moved really quickly.
Yeah, that sounds really awesome. And so going back to the initial growth stage, what were the challenges, Olaf, you find folks faced when trying to get things started up that you either didn't expect or that just kind of popped out of nowhere?
That's a good question. I think mainly it was noticing how much duplication of effort was happening, and especially around supply chain. So for example, the willingness to make face shields, that we came up against a lot of challenges with different designs, and different things wouldn't, certain designs wouldn't work in a medical application. So finding a team of people, a team of engineers who are willing to work with medical professionals and get stuff tested in the field, as well as get things PHSA approved. And so that was our biggest challenge. And I think what makes us most unique is that we have gone through the effort to make sure that we have well-designed and readily approved items that people can duplicate and make without putting too much stress on trying to reinvent the wheel all the time. So that was a major thing where we started the Facebook groups and the working group, and it became obvious that lots of people had lots of ideas, and we were all kind of doing different things, and some ideas worked better than others. And so I think the main challenge for us is focus efforts and really communicating to people that all of us doing the same thing at the same time is more effective than all of us trying to figure out how to do it over and over and over again in different ways.
Yeah. And what about COSMIC's experience? Because I know that you guys have really grown in terms of like the initial things you're working on to now having entire product showcases.
Yeah, definitely. I'd say one of the early challenges that we face is that we started with a group so small, just like 3 or 4 of us, and we scaled up so quickly that we were kind of like retroactively implementing a lot of the organizational structures that we needed, because there was like the initial feeling of the time crunch and like we need to move as fast as possible before this like full crisis hits. So then we have to figure out afterwards, okay, like we're bringing on all these people, but we need a formal onboarding process. We want to enable our projects to move as quickly as possible, so we're distributing our donation funds, but we need like a proper way of accounting for everything and keeping track of all the finances and that as well. So that was something that we're a bit more caught up now for sure, but back in the early days, that was a challenge.
We experienced that too. The infrastructure was really important. And now we have a volunteer that helps organize all the documentation and so on. It got really granular, didn't it?
And so what kind of advice would you give to other teams that are trying to start up similar initiatives to you guys who are in that early stage?
Do you want to speak to that, Alex?
Sure, yeah. I'd say I think it would be useful to kind of keep that organizational structure type stuff in mind from day one. So like you mentioned, Callie, like having somebody who is dedicated to organizing everything and making sure that the processes are in place to enable everybody else to do their work. If you can just really get that going as soon as you get all the technical work and the kind of the juicy stuff that everybody's excited to do, then I think that would make it all a bit smoother.
Mm-hmm. I think also not being afraid to recruit talent that maybe isn't like so sexy, you know, the people who are doing the admin support and doing all the documentation and making sure that things are easy to find, and little things like we get thank you photos or testing photos and videos from the sites that we deliver to, and just having them all in folders that have a naming convention. You know, the stuff that isn't really the thing you think of first when you start an organization, but is really, really important when you have a team of volunteers and essentially an organization that's always shifting who's responsible for what.
Maybe if I could say a few words with regards to COSMIC, our impetus came originally from projections at VGH and even around the world that in worst case COVID scenarios that we would run out of ventilators. And so the impetus originally was, let's build ventilators that could be locally sourced and manufactured in Vancouver. And since then, we've broadened our scope to focus on respiratory equipment and even some PPE. And I think throughout, what has been helpful is a really strong focus on our use case in terms of what are we building our devices or distributing our designs for. And we've had to be exceedingly flexible as well as our use case has shifted, because 2 months ago, our use case was Vancouver General Hospital. And since then, with regards to low-cost ventilators, our use case has shifted to be more global in scope. And so the importance of open sourcing and making sure that someone else could reproduce our designs and our work has increased. And we have really been making an effort to reach out to the low-resource communities that are maybe at the earlier part of the COVID-19 wave that could potentially use the devices and equipment that we're building.
I think that's a really important distinction, Philip, that that teams have to be willing to test, and they have to be willing to shift their focus. Like, for example, we have lots of different opportunities to work on different projects, but we want to make sure that we're focusing on the thing that's highest priority, and the things that are highest priority are the things that can that are for sure could be used in our use case. So I think there's been a couple of examples of projects where it was a really good idea, but then in practice and testing it out, it didn't work at all. So we have to be willing to abandon our really good ideas sometimes in favor of evidence.
And so have there been other times where you guys have had to pivot due to like changes in the evidence or just changes in the context you guys were operating in? Because that's something that a lot of teams have been facing.
I can speak to that, but maybe before I do, can I just share my screen?
Yes.
Just so that I can give people a slightly better sense of some of the projects that are working, that are our focus at COSMIC. So this is cosmicmedical.ca, the homepage, and so I'd encourage people to check out the website to learn more. And these are some of the projects that have come out of our various initiatives. So originally our focus was on ventilators, and the most simple solution that we have created is a bag valve mask squeezing mechanism that provides a mechanical squeeze of a bag that can provide positive pressure ventilation and help a patient to potentially breathe for a short period of time. And then over here, we have what we call our gravity ventilator, which as far as we're concerned is a entirely innovative approach to that regulates the pressure that's provided potentially by the hospital's pressurized air supply to the pressure that would be appropriate for ventilating patients. So we can do pressure controlled ventilation with the gravity ventilator. And then on top of that here, we have another project, which I think represents a bit of a pivot for us, which is as we were working on our ventilators, we realized that if we're designing for a low resource setting, it would be important to be able to provide pressurized air to patients to be able to support their respiration, whether it was on a ventilator, BiPAP, CPAP, or otherwise. And so that led us to create what we call the clinical respiratory support team, which is designing this unit right here, which can provide pressurized air in a field hospital setting. And so that represented an example of a pivot in that some of the people from the ventilator teams focused on providing the air supply such that we would be able to set up anywhere. And then these are projects that also, I think, are representative of the user better understanding what our users really needed, in that we have a snorkel mask project, which is works both as an N95 mask as well as a face shield. and that can be used both for the provider as well as the patient if they're getting CPAP or BiPAP. And then this is our final project here, which is the bubble helmet project, which is focused on providing support to patients through non-invasive positive pressure ventilation. So it's effectively a means of helping patients breathe without putting them on a ventilator, something that hasn't really been pursued to date within North America because there hasn't been a good way to provide positive pressure without causing aerosolization of particles that then kind of COVID-19 aerosol that then leaks into the environment and becomes a transmission risk. And so again, kind of because we were really dynamically interacting with clinicians, we got a sense that providing a comfortable and safe bubble helmet would be critical to giving clinicians an extra kind of option in the COVID-19 treatment pathway. So I would say those are just, those give you a flavor of the projects that we are working on COSMIC, and many of those were pivots, and that we didn't know when we set out that would be, those projects would be what our users needed. And then another really cool thing I just wanted to share is we've been able to team up with the Arts Club, which has kindly, or the Arts Club Theatre Company, which has kindly donated space within their BMO Theatre Centre, where we have set up essentially a research field hospital. And that has given us the ability to put all of our design teams in one place and to show that and to demonstrate effectively the full scope of what our design teams are able to do in terms of caring for COVID-19 patients. And on the right here, you can see we've even been very fortunate to team up with Gabriel Gayland and several other very talented video producers, such that we've been able to film all of our design teams in action. And we will soon be releasing those videos so that we can really effectively share with the world what we have designed, so that people can jump on our website and make use of our open source designs wherever they are in the world and wherever that need is. So that's a little bit of background, and I think all of those have been pivots for us as we've evolved and realized where the needs are. First, it's clinical needs, and then as our design teams evolved, we realized that if we're going to successfully open source and share our designs, we need to be able to share in an effective way what we've done, hence the collaboration with the Arts Club Theatre and videographers. So that's it in terms of me for sharing my screen. Yeah, sure.
Awesome, thank you for that. Yeah, definitely. So if you were viewing our YouTube video right now, please check the comments and annotations for direct links to those videos and resources.
I wanted to add to your demonstration, Philip, that I happen to have one of the masks that you guys tested. And we tested this one for a couple of hours just for comfort and fit and to see if it would work. And it did end up to be a pretty tight fit, and to wear this for more than an hour or so wasn't very tenable, we found. But the design is great, and I love that you really made the effort. Your group makes the effort to test it with real clinicians in the field, and that, I think that really makes a big difference. It's not just a group of people with an idea; it's verifying that the idea really works.
Yes, and I think probably feedback from others helped us to realize that one of our original care homes, where we envisioned providers potentially being able to wear it for 8 hours, wasn't going to work. And so that was an example where we were able to get feedback and pivot, and we're now focusing more on kind of high-risk COVID-19 interventions, which are shorter in duration too.
As we're approaching the end of our panel, we'd like to thank everyone again for joining us today. If you guys have to start logging off or heading off, feel free to. But if you'd like to stick around and continue the discussion, we would be more than happy to continue the recording. Other than that, to our dear viewers, thank you for joining us. Please check out the links in the video description to learn more about these awesome teams. And also take a look and see if that some of them are hiring or expanding their services or listing up the materials or things they need. Support them, and you can make a difference. So thanks again, everyone. All right, now on to the OSMS's favorite part of any meeting, the rich discussion. So we'd like to open things up again, and feel free to continue the conversation.
Okay, cool.
This is Lee Christie. I was listening to the whole thing, and I just wanted to say thank you so much for taking the time. We really do appreciate all of you participating. And I as a sort of a guiding principle behind what some of the things that you said kind of really resonated with me today, because I sort of do feel like at the OSMS BC, in a lot of cases, we're trying to help different design teams and manufacturing teams be successful in their endeavors. And we're just constantly searching for things that we can do to help. And often those things are not the sort of rock star, sexiest things in many cases. And often when they are, when an engineer comes to us and they're like, yeah, I just want to work on the hardest, craziest, coolest thing, often we can become a source of funneling some of our volunteers to those design teams to give them a little bit more engineering power, but under their flag, not our flag, right? And so I was really inspired by a lot of things you said today, and I just wanted to say thank you, and that we really hope that we can continue to try to level up our own capabilities to be as supportive as possible to the community. So thank you so much.
Well, I would say OSMS BC's Slack has become one of my favorite places to hang out, because there's lots of really great conversations and pearls and information that's shared there. So it's been a very helpful platform for myself and many of the design teams that are kind of under the COSMIC umbrella. One point to make that we have been struggling with, and this might be something that Callie can speak to as well, is understanding the legal liability associated with open sourcing biomedical engineering hardware design. And it has caused us some delay on our end, because we wanted to have a better sense of who would hold, what the specifics are of the liability, where the liability falls in the context of an open source design being used. And it is not something that we've entirely solved. What happens if someone uses, let's say, a face shield, which has been shared online through an OSMS or COSMIC or YVRMERS channel, that ultimately turns out to be faulty. I think it's incumbent on all of us to do our best to make sure that there are safe designs and going through appropriate regulatory approval, but even understanding how open source biomedical engineering hardware can work in practice has been a challenge for us.
Yeah,
It's absolutely something that our mothership has made a lot of progress on in America. As you guys, many of you know by now, we affectionately refer to the OSMS, the organization of which we're the regional representative for. We affectionately call them the mothership, and they've made a huge amount of progress in the U.S. in terms of legal liability around open source projects. So we're using their framework. We think that they're much further ahead than Canada in that regard, and so we're using their framework currently. I'd like to customize it for regional. I'm always a fan of customizing for regional, but I think using their framework, if you want to see where we're at, most of the content that we've sent to them has been published as them, not us. So we've had an influence on how they're doing things. And but when it gets published, you won't see it under our regional name. You'll see it under the international brand.
Mm-hmm.
Excellent. Thank you for that.
I think one thing to consider with all of this is the immeasurable difference between the medical profession in the US and the regulatory bodies we have here in Canada. And I think it's probably a lot easier to complete these projects in the US because there are fewer checks and balances, but that doesn't necessarily mean that that's a good thing. So I think we should be mindful about comparing solutions that work in the US with solutions that work in Canada. And I think you touched on that, Lee, that we do have to be thoughtful about how we present these ideas regionally and how they integrate into our system. making sure that we get PHSA approval, for example, the Provincial Health Services Authority, making sure we get Health Canada approval. As long as we can go through those steps and those processes and get those designs approved in that fashion, then I think that that's a much safer way to go about it. And unfortunately, that takes a little bit longer because of bureaucracy, but ultimately, I think that's a much safer, more sustainable way to go.
Right. Yeah, no, I couldn't agree more. And I'm kind of fascinated by some of the difference. I lived in America for 7 years. And so I've actually seen quite a few of the innovation advantages they have south of the border. We tend to be a lot better at coming up with technologies that are preventative. They tend to come up with really great treatment technologies. And the combo actually it's not the worst combo in the world, to be honest. And I have to say, there's plenty of things. I get up on my high horse as a Canadian and criticize the hell out of America. But I occasionally we learn a few tricks from them. And, some of the tricks we're learning from the mothership, which is based in the US, is, I'm pretty confident that in many cases their intentions are good. And so we don't assume bad intentions when it comes to some of the ways in which the mothership is rolling things out. But we're very critical of the mothership, right? So when things get rolled out, where they're like, yeah, this is the way it should be internationally, we take a page out of the Engineers Without Borders playbook, where we're basically saying we have to be humble in our approach globally, and not try not to be prescriptive on others. But we are a little bit prescriptive regionally, though. So one thing that we've started doing is we've become advocates for certain kinds of PPE and certain kinds of manufacturing laws and rules, and trying to basically make it easier to do business in British Columbia, and try to make it easier for all these researchers and these engineers and manufacturers to do their job. And we're at the point now where, thankfully, people are listening to us, right? Like politicians are listening to us. The rule makers are listening to us. And so that's one of the reasons why we're so adamant about trying to make sure that we support our design teams as much as possible, because that's where all this is coming from, right? Is like the clinicians, the epidemiologists, people doing the data modeling, like the people who really understand just how big of a problem this is long term. That's what motivates us, hands down, right? Is to try to get the smartest people together and really understand deeply what it is that they need in order to be successful. So thank you for participating in this again today. And I actually just wanted to open my line up to all of you. Like, if any of you need to contact me for anything, don't hesitate to reach out on Slack. I'm assuming most of you are already on our Slack, but I'm pretty, like, when it comes to like keeping my door open, like I'm readily available. If you need to pick my brain about something, I'm here to help. And the easiest way to reach me is through Slack. So don't be shy. Hit me up.
Sounds good. I think it's, as an aside, I think it's interesting, even being Canadian and not having any American experience, just being an average Canadian, I suppose, and marrying into the medical professional, it's been so wild beginning to understand how things function here, and how I think there's a lot of opportunities for innovation and community building. And like one example of that is not recognizing that there isn't, each hospital orders its own supplies, and they have a different person for each, and essentially each health region in BC operates kind of in a silo. And just understanding all of these things that, frankly, personally, I assumed it didn't work that way. I assumed that everybody knew what each other was doing, and that they had the same standards, and they had the same ordering process, and they have the same database, and that's not the case. So I think it's an ongoing process of understanding what the system is that you're working with, and then learning how to address those issues in those systems. It's just wild. I thought it was much easier than this, and it wasn't.
Yeah, it's very complex. The delivery of healthcare is complex, and the kind of ecosystem around it is complex here in BC. And I think we're not alone in having complex procurement processes. That's great points. I think I'm going to jump off. Lee, it's always great to see you on the interwebs, and Kaylee, lovely to meet you.
Likewise.
And I will, I've been also regular on the YVRMERS Slack and look forward to staying in touch and seeing how our respective groups can collaborate and work together.
Yeah, thanks again for your time, Philip.
Thank you, everybody.
Yeah, thanks, Lee.
Was there anything else you guys wanted to discuss? I mean, since we're on the call together?
Yeah, like I've seen that there's been a lot more activity around building tools that other types of frontline workers need aside from medically trained ones. Where has that taken BAMERS?
That's a good question. So as you know, we started out with the intention and focus on serving frontline healthcare workers. But one of the things we realized early on is there were a lot of other groups that we could be reaching out to. And in fact, we have an outreach lead that's been cataloging all of this, but reaching out to other organizations and really working to not just working with them to fill their needs so that our needs can be filled. So for example, very early on, we were concerned about the lack of N95s and the lack of surgical masks. And we thought, well, who has extras of those potentially? And what could we do there? And one really simple solution, but it just really took some calling around and understanding what was going on, was contacting vet clinics. They have medical supplies there, but they don't necessarily need the kind of protection like an N95 or a surgical mask that of course a human medical professional might need. So instead of, so we could, I'm a little still fuzzy from my weird evening, but what we realized we could do is we could free up some of the supply from vet clinics so that they could donate their surgical masks and so on to medical providers, and then provide those vet clinics with homemade masks, because all they need is protection from spray and from just general fluids and so on, but they're not so concerned with COVID-19 that they need an N95. So we could free up a whole supply of N95s and potentially surgical masks for the medical community, and replace those with maker-made masks and PPE for a place that's a little less risky. So there are lots of little opportunities like that I see where we can approach other groups, like the Downtown East Side, for example. We were doing a lot of work with the groups in response to providing PPE to nonprofit communities and for the folks who are working with vulnerable populations. Yeah, they're not medical providers, but they need the same kind of medical level protection from something like COVID-19.
Yeah, definitely. That sounds like you guys are doing a lot of great work, helping and supporting those type of communities as well, based on some of the stuff coming on your social media. So if you're a viewer, be sure to check that out. And speaking of certification and building things, Alex, what's it been like creating healthcare equipment out of stuff you're getting from the hardware store?
Yeah, it's been super interesting. That's kind of like one of the things that we wanted to do from the beginning. Was obviously you don't want to tie up anything that's going to be used in the traditional medical supply chain, and then also in a worst case scenario, like things that are readily available locally at hardware stores are going to be preferable to something that's going to take months and months to ship. So yeah, we've really been trying to incorporate local supply chain materials into our devices wherever we can. And we've even done some work adapting other teams, groups, designs to fit our local supply chain. So for example, that bag valve mask squeezer that Philip showed a little while ago is actually Rice University's design. I don't know, maybe you guys have seen it. It's kind of a popular design out there. But they released that fully open source about a month ago. Super cool design. We wanted to try to build it here, but we quickly found that some of the things they were using are being shipped from like China on AliExpress and would take like 2 to 3 months to arrive. So we kind of put our hacker hats on and figured out some solutions and like we were using like drawer sliders from like Home Depot instead of these robot linear rails and things like that. So yeah, it's an interesting challenge trying to build medical grade equipment while using things that are never traditionally used in that type of equipment.
Yeah, I noticed too that the so the Home Depot and so on has things like the KN95 that are meant for filtering out paint particles and so on. And I think one of the most personally interesting projects for me is making add-ons. What's the word I'm looking for? Converting a KN95 essentially to function like an N95 by adding additional filtration. Totally lost my word here, but you know what I'm saying. I think that that's really cool because the access to something like a KN95 is pretty universal, and you can find it locally in your local hardware store. Wouldn't that be cool if everybody could use their local hardware store and just make an adaptation to that device to make it more suitable for something like COVID-19?
I like the way you're thinking, and I actually, I'm kind of wondering if we've been thinking about masks all wrong, right? Like what you said earlier about finding supply for the vet. Like I think that same principle applies the whole way through the supply chain, like all the way down to the individual playing sports or going for a run or going for a bike. Like there needs to be dozens, if not hundreds, of different kinds of masks. There's different masks for different occasions, and if we want mass consumer adoption of them, the biggest barrier right now is cultural. It's not technological. People don't realize, like, even just a basic, super comfortable, fashionable cloth mask filters out a huge percentage of not just droplets, but aerosols too. Like, you can get, with 2 layers of cotton, you can filter something like 30 to 40% of the aerosols.
So here's a really interesting point that this brings up, in that there seems to be a misunderstanding about what masks are used for. And also, in specific to COVID-19, there's this unfortunate misunderstanding that it's airborne, and it's not. What a simple mask does for an individual is keep your droplets from affecting other things or falling onto other things. And the major issue with COVID is contact transmission. So basically, if you're touching something in the grocery store and you touch your eyes or your mouth or your mask, then you're transferring that to you. And what you're trying to do with your mask is make sure that you're not spraying stuff that is coming from your body to the world around you. So I think people really don't quite grasp yet that the purpose for the masks, and I kind of disagree with you. I don't think that there needs to be a wide array of masks. The people that need the medical grade N95s are the medical professionals or the frontline workers who are in direct contact with COVID-19 patients in an intubation procedure environment. Otherwise, it's not aerosolized. The intubation process aerosolizes COVID-19, but otherwise, it's merely just contact and droplets. So a simple mask for 99% of the population is just fine. And making sure, I think the educational piece of making sure that people understand how that works is an interesting path, because even personally, at first the CDC was saying don't wear masks, and I was all over that, like, don't wear masks, not just because you're taking that process or that those products away from the people who actually do need them, but also because you're using a supply incorrectly and essentially sullying what could have been protection for somebody who used it correctly. And like the number of people who still don't quite understand why they're wearing a mask and how to don and doff properly, and the purpose of gloves and how to don and doff gloves properly, and so on. I think the scientific communication aspect of it and the education piece of it maybe even more important than the making of these items.
Sure. And but you certainly could have one before the other, right? Like if people started using masks first and then got better at using them, we'd see an increase in we'd see a reduction in the radius of infection.
Sure, absolutely. Yeah. As long as they're using them correctly, and otherwise it's just creating more environmental and yeah, it's just creating more issue. But yeah, I think you're right that it's better that people get into the habit of using it, even if they're maybe not great at it in the beginning. And if we can make that cultural shift of, hey, I'm wearing this mask to protect you because it's an act of courtesy. I think if we can get people believing and understanding that would be a lot farther ahead.
So we did this survey. We give out free masks, and as a reward for people answering our surveys about masks. And one of the questions on the survey is, do you think when people are sick that they should wear masks? And in Vancouver, so far we've had it's not statistically significant, but it's like 100%. We've yet to find a person who doesn't think you should wear a mask. So it's
right.
Pretty, yeah. So people believe in it. So which begs the question, well, then why isn't everyone wearing masks? And I think that, the answer is, quite frankly, is that people, they're contagious with COVID often when they don't even know they're sick, or they think they're barely sick. And, it's really at the heart of it is that, like you said, education, using evidence-based reasoning and science, frankly, to help people understand things that are difficult to understand from mainstream media. Mm-hmm. And that's like this. I don't want to get all political here, but I really do feel like a lot of what we're trying to do as engineers, as manufacturers, is being undermined, unfortunately, by media and political forces. And meanwhile, the scientists and academics are all on the same team. Everyone's like, yeah, let's use evidence-based reasoning to make decisions here. But there's people that just have no business in this argument, is politicizing it and turning it into a media circus. And that's what we're really trying to keep that to a minimum while being on the right side of history.
Yeah. What I've learned is that it doesn't matter how much evidence you have and how much expert opinion there is and how much good data you have. If we're not communicating it to the layperson in a way that is understandable and accessible and isn't putting them down for not understanding it before, is really allowing them to save face a little bit around something that they don't have a lot of education on. I think that's
it can't be condescending. It can't be condescending.
Yeah,
totally.
And it's a tricky thing because it's really frustrating for medical professionals and engineers to be like, this is what works, this is the data. It's basically all of human progress versus your Google search. It's a rough thing to have. You know what I'm saying?
Yeah.
No, but they went to the third page on Google, so they did their research. The third page. Research.
Yeah, and even people's understanding of what research really means is not true. It's not. There are entire degrees focused on how to do research correctly, and yeah, I think I've observed some interesting stuff just from a communications perspective. It's neat to hear from the inside of the medical community how things are discussed, and then how things are communicated by, say, Dr. Bonnie Henry to the community at large. And I noticed that some people, they feel like they're not getting all of the information, and the reality is they're not, but it's because they don't need it. They just need to follow simple instruction. And the whole wear 6 feet apart, wash your hands, all of that seems overly simple for people, but
right.
The reality that is the evidence, that is the hundreds of years of human progress.
Right. But they were slow on the masks though, right? For exactly like you said, because they were worried about all the inventory getting sucked up, and they're basically protecting the medical establishment from a run on the bank of sorts, right? And so it was one of the first times I've seen a global science-based organization prioritize consequence over the evidence. like, I'm not saying they said anything that was wrong. I'm not accusing anyone of doing anything that was wrong, but I would say that, like, when we saw the WHO outright say, like, look, masks aren't going to help that much, you know, people believed that, right? I mean, people really, like, North America and Europe were much slower with the masks than we probably could have been otherwise.
I think, oh, go ahead.
I was going to say, I do understand from a mass communication perspective why they would choose to do that, though, because if you have, you know, billions of people rushing to wear masks, and then we're all screwed. We're all screwed if our medical professionals aren't protected.
Yeah,
so,
for sure. If people start stealing shipments of masks and stuff, like, that'd be insane.
In hospitals, people were they had to take all of the PPE and put it under lock and key for, like, at Royal Columbian, for example. It was people even working in the hospitals were stealing things for their families and so on. So
wow, that's crazy. That's so crazy.
So that's the thing is what's the greater good, is telling people, hey, you don't need this, because they're going to use it improperly and take up all the supply away from people who can use it correctly and will save their lives? Or do you tell them all the information and say, here's the situation, and then risk a lot of people just not understanding that?
I don't think it was an easy decision for anyone. But what I do feel very confident now is I feel very I feel very confident that we'll be on the right side of history if we're advocates of wearing masks when you're sick and in public. If you're anywhere outside of your own home and you are sick, you are, I would argue, are morally obligated to wear a mask. And that's a thing that I think that's a cultural trait that is dominant in Asia and is not in North America or Europe. And we are perfectly, I think, like, just as humans, not so much as an organization. I'm removing my OSMS BC hat here for a second, but as humans, like, we absolutely get to choose if that becomes a cultural trait or not. We absolutely get to choose. A lot of people think that that's an impossible thing to choose, and I think it's not true. Just with greater education, more and more people will inevitably, already in Vancouver, 100% of the people polled agree with it. So eventually the political will be there. The question is how does Canada deal with it without intruding on people's civil liberties, right? And that's where I think that's where we butt up against. That's the argument that we lose every time, right? Is once it becomes an issue of civil liberties, we tend to lose.
Mm-hmm. I think the fashion aspect of it can actually be the solution, because if it becomes like a fun accessory or a status symbol or something that people can show off, like, hey, look at my fun mask. Like, Sean and I have ordered a bunch of things from different makers and gotten lots of, like, happy, where'd you get that? That's so cool, or like, that's so weird, or fun. If people look forward to actually using a mask and using it as a way to express themselves and start viewing it as a fashion accessory, I think that will get more people on board than merely saying the evidence says, because people don't necessarily make decisions with reason, they make it with emotion. So that's what I know as an
that's why I'm so in favor of open sourcing the best mask designs. I really do think that subtle differences in the patterns in terms of fit around the nose, like just making really comfortable, fashionable masks is not easy. Like, it's easy to make something that looks decent, but like getting something that has both the comfort, efficacy, and the style, I haven't seen anyone do it yet. Like, actually the best ones I've actually seen have actually been really expensive. Like, people have actually made like pretty good ones, but they're like, the BOM cost is like a couple $100, right? Like, yeah, have you seen these fashion ones coming out of New York? They're like making like really like super fashionable ones. They're pretty cool. They're like, yeah, they look like, yeah, they look amazing actually.
And there's others that like they custom 3D print like a frame that fits around your face that they put the cloth over.
Yeah.
And that is also like pretty expensive, because on BC 3D
custom fit.
Yeah, they're like resin printing it for whatever reason to make it like extra comfortable or something. But it looked really expensive.
Yeah, but if you can get like a silicone custom print of a custom fit mask, and then you change the covers over and over again, then sure, you might invest in that thing, but that's potentially something you can use for the rest of your life. and you can
if someone can make, so sorry to interrupt, if someone can make that fashionable, right? Like if you can make the thing that custom fits your face look not insane, I think that's definitely the winner, right? Like, but a lot of people aren't going to wear the like bubble, the huge bubble on their face. Like a lot of people they want something like tight fitting, conformal. It's hard to do. I don't think it's.
Oh man, you know what I saw that was probably my favorite so far, and it's so simple. Like, duh, why didn't we think of this? Is getting it like an image of your own face, your own smile on your mask. So, like, come on, how easy is that? Like, you can walk around just with a smile on your face, your smile, your face, your everything. So it just looks like your regular face if you're not really looking very closely. I think that's brilliant.
Lee, we can't.
Oh, Lee, we can't hear you.
Make it reversible, right? Like a frowny face.
Yeah.
Flip it over, and it's like a different pattern.
Yeah, totally. Like you could totally do that, or you can. I think people can have a lot of fun with it. Like I'm really looking forward to seeing what the artists and the fashion designers and the fabric people really come up with, because I think that's brilliant. Like, why the heck not? Why wouldn't you want to get imaginative with these things and have a little fun with it?
Yeah, for sure.
Anywho, I think that's it for me, guys. This has been really illuminating, so thank you for putting this together. And Lee, thanks for poking me on LinkedIn enough times to get me involved.
I really, really appreciate it, Callie. I really appreciate you being here today. And yeah, keep sending us that critical feedback. Like the more you can tell us, like, this is what's important, this is what we need, the more we can help. And that, we need to galvanize our workforce around, we need to focus on what we're helping with the most. And the more we can hear the needs of the groups that we try to support, the easier it is to galvanize the troops, to kind of rally the troops and get, you know, what's the word I'm looking for? We really want to hold, we have a huge volunteer base. We really want to get them focused and working on the things they want to work on. Let's go that way.
Yeah, definitely. Cool. Well, thanks for your time, Yajur. Thank you for facilitating the conversation. That was really easy. So thanks for making it easy.
Oh no, thanks again for all of you guys for doing your part to fight COVID. And now it's time for viewers like you who are interested to also join in. So please take a look at the links that are posted in the video below. And finally, one last thing before we sign off, we'd like to give a very big shout out to Lee. Thank you again, Lee. Lee was one of the first people in Vancouver to be like, hey, like, what? Maybe not the first person in Vancouver, but one of the first people to be like, okay, we need to start like building groups together. And so he talked to a guy who built a giant robot who was also named Guy, and together they started one of the first open source chapters in Canada. So big shout out to you, Lee. Thank you. Oh, look, I think Lee's trying to show us something.
Oh, cool. Here,
I'm going to spotlight the video.
Yeah, sure. So I'm actually at the EDART lab right now. So behind me is this is like, this is basically a giant electromechanical walking machine behind me. So yeah, Yeah, I'm not sure we're allowed to, I'm not sure how much I'm allowed to show you. And these are this lab is called the EDART lab. So maybe one day the OSMS BC will have our own lab space.
Hey Lee, you know the big robot mech there as well? It's a costume. Not that one.
The costume. Oh yeah, of course. Yes. Yes, that's right. Yeah, he told me that. It's actually right behind me.
It's 6.
Right.
Yeah, that's Sean made that. That's a costume that Sean made.
Yeah.
Wait, is that like the power thing from Aliens? Wait, sorry. It looks like the suit Ripley wore.
Yeah. I can send you the YouTube link to that, Yajur, if you want.
Yes, please. That would be really awesome. And that video will also be available.
Yeah. Little fun projects that makers make. All right. That's it for me. Thanks so much.
All right. Thank you. All right, folks. That looks like that's our show for tonight. So thank you again for tuning in. and we hope you have a wonderful day.